Think your foot pain is just a local issue? What if it's actually coming from your lower back? Let's find out. Hello, this is Dr. Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. I specialize in diagnosing and treating musculoskeletal pain with advanced non-surgical techniques. Today, we're exploring a fascinating and often misunderstood connection: how foot pain can actually start in your back. Foot pain is something many of us experience at some point, whether it's from standing too long, an injury, or even wearing uncomfortable shoes. But what if your foot pain has nothing to do with your foot? Your spine, specifically your lower back, could actually be the hidden culprit. Let's break down how this happens, what symptoms to look for, and how you can treat the root cause of your pain. Most people don't associate their lower back with their foot pain, but the two are closely connected. The nerves that control sensation and movement in your feet originate in your lower back, also known as the lumbar spine. If there's an issue in your back, like a herniated disc, nerve compression, or spinal stenosis, it can send pain signals down your legs and into your feet. This type of pain is called referred pain, and it's more common than you think. Here's a real-world example. Imagine someone with a pinched nerve in their lower back. They might feel sharp pain, numbness, or tingling in their foot, but the actual problem is in their spine. Without addressing the back issue, treating the foot itself won't provide lasting relief. Let's talk about what conditions in the back can lead to foot pain. A herniated disc. This occurs when the soft center of a spinal disc pushes out and presses on nearby nerves. Sciatica. This is irritation or compression of the sciatic nerve, which runs from your lower back down to your legs and feet. Spinal stenosis. Narrowing of the spinal canal can pinch the nerves, causing pain that radiates to the feet. Degenerative disc disease. As discs wear down with age, they can irritate nearby nerves and cause foot pain. SI joint dysfunction. If your sacroiliac joint is inflamed or misaligned, it can affect nerves that lead to the legs and feet. Each of these conditions can cause different symptoms, so understanding the exact cause is key to effective treatment. How can you tell if your foot pain is actually coming from your lower back? Here are some red flags to watch for. Radiating pain. Pain that starts in your lower back or hips and travels down to your feet. Numbness or tingling, or a pins and needles sensation in your toes or feet. Weakness. Difficulty lifting your toes or foot, often called foot drop. If symptoms are worsened by certain movements, such as bending or twisting the lower back or sitting for long periods, might make the pain worse as well. These symptoms are often linked to nerve involvement in the spine and may require further evaluation. To understand how back issues cause foot pain, let's look at the nervous system. Your spinal cord is like a highway, with nerves branching out to different areas of your body. The nerves that supply your feet originate in the lower lumbar spine. When these nerves are irritated or compressed, they can send pain signals to the feet. For example, the L5 nerve root controls sensation and movement in the top of your foot and your big toe. Meanwhile, the S1 nerve root affects the outside of your foot and your little toe. By identifying which area of your foot is affected, we can often trace the problem back to a specific nerve in your spine. If you suspect your foot pain might be coming from your back, it's important to get a proper diagnosis. Here's how we figure it out. First off, history and symptoms. We'll ask when your pain started, what it feels like, and if it radiates. Physical examination. This includes testing your reflexes, strength, and sensation and range of motion. Imaging. An MRI or CT scan can reveal issues like a herniated disc or nerve compression. Other diagnostic nerve tests, like an EMG test, can also look at and measure how well your nerves are functioning and help pinpoint the problem. The goal is to find out exactly what's causing your pain so we can treat it effectively. The good news is that many causes of back-related foot pain can be treated without surgery. Here are some of the most effective options. Physical therapy. Strengthening your core and improving posture can relieve pressure on your spine and nerves. Regenerative medicine treatments like platelet-rich plasma and bone marrow concentrate treatment can help improve stability and reduce inflammation, leading to less pain and better function. Image-guided injections. Using fluoroscopy or X-ray guidance, we can deliver strong anti-inflammatory or regenerative treatments directly to the affected nerves. Lifestyle changes. Losing weight, improving your posture, and staying active can all help relieve and alleviate pressure on your spine. Our goal is always to treat the root cause, not just mask the symptoms, so you can get back to living your life. If your foot pain isn't improved with rest, ice, or over-the-counter treatments, it's time to see a specialist. Ignoring the problem could lead to longer-term nerve damage or mobility issues. Early intervention is key to preventing further complications and getting the best results from treatment. Thank you for your time. If you found this helpful, please give it a like and share it with someone who might benefit. For more tips on pain management and cutting-edge treatments, subscribe to our channel and visit us at chicagoarthritis.com. Let's work together to get to the root of your pain so you can live well.